So I am Antonella Muraro. I am a pediatric allergist working in University Hospital of Padua, the Food Allergy Referral Center. I am a past president of EAACI. My term was 2015-17, and I am the current chair of the EAACI Guidelines Committee. I believe that EAACI has a huge task, which is now to develop a new model for clinical trials and to develop health economics and cost effectiveness for allergic diseases, treatment and prevention. And this will be crucial in the next years in order to develop a sustainable services approach to the patient. Currently, there are the food allergy and anaphylaxis guidelines published in 2014, which will be under revision and will be published in a sequence from 20 to 21. And then just published last year the allergen immunotherapy guidelines. The main benefit is that for the very first time there is a description of a recommendation based on evidence that can be used by clinicians as standard of care, not only in Europe, but hopefully also outside Europe. And again, for the very first time, we have described research needs and gap in implementation that can be used by policymakers and regulators. Before the publication of the EAACI guidelines, we had the fragmentation of recommendations across European countries. For the first time, we have an harmonized approach. The guidelines involved not only 100 clinicians, but the patient organization, stakeholders from regulatory bodies, and also they were commented on a public website by industry. So we have tried to collect all the perspectives and to produce an harmonized approach to food allergy anaphylaxis and to allergen immunotherapy. But this is only the start of the journey. The very difficult part will be implementation, and implementation needs a lot of effort from and alliances among scientific societies, not only at the global level but also at the national level, where local groups will adapt the guidelines, trying to take over successfully the local barriers. After the publication of the food allergy anaphylaxis guidelines, for the very first time, the European Medicine Agency harmonized the prescription of self-injectable adrenaline, which was very diverse in diverse countries, for patients at risk. So now, after that, we had an harmonized indication for prescribing the self-injectable adrenaline device to all patients at risk. And further to that, European Medicine Agency, following recommendation of the guidelines, EAACI guidelines, delivered a recommendation binding all the European countries to prescribe 2 adrenaline for each patient at risk. We would like to set a platform where alliances among scientific society at the global level and local group can produce initiative both on intervention studies and on dissemination of the guidelines that can be translated in concrete support to our patients.